Welcome dear student. Today's in my lecture course named Determinant of Quality Life topic is hypertension. Learning outcomes of this module is at the end of this lesson, a student will be able to demonstrate and comprehensive understanding of hypertension, accurately classify blood pressure levels, analyze risk factor and clinical signs of hypertensive patients, outline an appropriate diagnostic and therapeutic approach, apply knowledge to prevent and manage hypertension effectively. What is hypertension? Hypertension or high blood pressure is a condition in which the force of blood against arteries wall is consistently too high. It is a major risk factor for cardiovascular diseases and often present without symptoms, hence termed as silent killer. Definition of hypertension is defined as persistently elevated arterial blood pressure according to the American Heart Association. Normal systolic is more than 120 mmHg and diastolic is more than 80 mmHg. Elevated systolic is 120 to 129 mmHg and diastolic is 80 mmHg. Stage 1 hypertension, systolic is 130 to 139 mmHg and diastolic is 80 to 89 mmHg. Stage 2 hypertension, systolic is less than more than or equal to 140 mmHg or diastolic is less more than or equal to 90 mmHg. Repeated measurement confirm a diagnosis over time or via ambulatory monitoring. There are two major types of hypertension, that is etiology, that is primary or essential hypertension account to 90 to 95% of cases, develop gradually over years without a clear identifiable causes, influenced by genetic and environmental factors. Secondary hypertension resulting from identifiable causes such as kidney disease, adrenal gland tumors, congenital heart defects, medication, example NSAIDs, oral contraceptives and endocrine disorders. Risk factor of hypertension is categorized as non-modifiable, age, risk increase with age, family history, genetic predispositions, ethnicity, higher prevalence in African population. Modifiable risk factor is obesity, increased workload on heart and vessel stiffness, sedentary lifestyle, high dietary salt and low potassium intake, smoking and alcohol consumptions, chronic stress and poor sleep hygiene. Pathophysiology of the hypertension. The pathophysiology of hypertension involves complex mechanism, increased peripheral resistance due to vasoconstrictions, activation of the renin, angiotensin, aldosterone system lead to sodium retentions and increased blood volume. Overactivity of the sympathetic nervous system raises heart rate and vasoconstrictions. Endothelial dysfunctions impairs vasodilation due to reduced nitric oxide availability. Clinical feature of the hypertension is often asymptomatic and detected during routine screening. When symptoms are present, they may include occipital headache, especially in the morning, dizziness, tinnitus or blurred vision, palpitation, chest discomfort, epistaxis, nosebleeds or fatigues, long-standing uncontrolled hypertension can lead to target organ damage. Diagnosis based on repeated blood pressure measurement using sphygmomanometers, ambulatory blood pressure monitoring and 24-hour evaluation. Laboratory test, serum electrolytes, kidney function test, fasting glucose and lipid profile. ECG to detect left ventricular hypertrophy, fundoscopy to assess hypertensive retinopathy. Lifestyle modifications. Lifestyle changes are foundational to hypertension control. Dietary diet rich in fruits, vegetables and low-fat dietary limits salt is less than 5 gram per day and saturated fats. Physical activity at least 150 minutes per week of moderate intensity exercise. Weight loss, even a 5 to 10% reduction can lower BP. Limit alcohol, example, more than equal to 2 drinks per day for man or equal to 1 for women. Cessation of smoking, stress management through relaxation techniques. Pharmacological management of hypertension. Drug therapy is guided by blood pressure levels and comorbidities, first line medication. ACE inhibitors, example, enalapril, block angiotensin II productions. ARBs, example, losartan, block angiotensin II receptors. Calcium channel blockers, example, amlodipine, relax blood vessels. Thiazide, diuretics, example, hydrochlorothiazide, reduce blood volume. Second line agent include beta blocker, aldosterone antagonists and alpha blocker. Complication of the hypertension can damage various organs as a cardiovascular, left ventricular hypertrophy, myocardial infarctions, heart failures. Cerebrovascular, ischemic or hemorrhage stroke, vascular dementia. Renal is chronic kidney disease and ocular retinal damage, vision loss. Prevention of the hypertension is preventing hypertension involves both individual and public health strategies, regular BP monitoring from age 18, public education on healthy lifestyle, reducing obesity and promoting physical activity, low sodium and balanced potassium diet, reducing its stress and ensuring good sleep hygiene. Hypertension is prevalent and potentially deadly condition with widespread health impact. Early detections, consistent monitoring, lifestyle modifications, and appropriate pharmacotherapy are essential to prevent its complication and improve quality of life. Thank you.